educational lessons on radical responsibility in birth planning, where to have a baby, who's going to attend your birth, all of that stuff. But then there's also quite a bit of time dedicated to lifestyle modification in order to avoid all of the complications under the sun. We go over the risks, benefits, alternatives to everything from vaccines to ultrasound to other injectables like vitamin K, RhoGAM, antibiotics, C-section. I mean, we go through everything that we could ever be asked. And so when you approach pregnancy through the lens of not being at war with nature but in alignment with nature, things just go better. So most of the lifestyle modifications are not going to be like, here's a protocol for using red light therapy to have a healthy pregnancy. No, it's going to be like, you need to sleep, you need to eat well, you need to drink lots of clean, structured water. And I do a whole lesson on water itself because it's so critical. Here's some basic movement patterns. Like, it's all of that stuff. And a lot of it doesn't cost us anything. It just is trying to prioritize our time and resources towards making these changes so that you don't avoid these otherwise preventable pregnancy complications, and so that you don't end up with a birth that is not anywhere close to what you were hoping for. So everybody loves freedom and all this stuff, but if you're going to be truly free, you have to be willing to own the outcomes of your decisions. And that's for the better or for worse. So we support sovereign birth, we support free birth, we support hospital birth, elective C-section, whatever it is that you feel is the right mode for you. I'm not going to tell you one way or the other. I think that most people would be just fine having a birth vaginally at home, regardless of what their clinical situation. Most people, with a midwife, of course. But that's not for everybody. So we try to accommodate everybody there, regardless of the history, regardless of whatever. You're going to go into your birth feeling as empowered as empowered, and sort of intuitively guided, with nature as your guide, as possible as you approach your birth. And there's also a unit for dads, which I think is sorely underappreciated right now, as to how men want to show up in the space and be responsible, conscious parents and partners and fathers. And then there's a whole unit on psychedelics and cannabis and other drug use in pregnancy.